If that's the case, then do you support using reconciliation to ultimately pass health care?
Well, I think that's what's going to happen if health care is to pass, and I would support doing that. We've passed a lot of major legislation through the reconciliation process in the past, and this would be another example of that.
Senator Orrin Hatch, your Republican colleague from Utah, writes this morning in the Washington Post that yes, reconciliation has been used in the past, but only related to budgetary issues, or if there's wide bipartisan support, like welfare reform and like children's health insurance.
Well, there was bipartisan support, there's no question for those, but there were not 60 votes for those. The real issue is, are you going to use reconciliation in order to pass something with a majority in the Senate? There has to be a majority in favor. Or are you not? And I agree that there have been other bills that passed as part of reconciliation that had some bipartisan support, but they did not have 60 votes.
You said that you're not sure it will pass. Can you give our viewers an idea of the likelihood that this might pass?
Well, I can't. Frankly, I think the real determination will be made in the House of Representatives. The House, of course, has a very narrow margin of folks who have supported this bill, and a few of them are no longer there, the ones who voted for it last year. And the question is, can they get enough votes in the House to go ahead and pass a series of changes to the Senate-passed bill so that we then could go ahead and have the Senate agree to those changes.
So our viewers should be watching the House deliberations on this.
I think the House is where the action is now going to occur, and if the House is able to agree on a set of changes to the Senate-passed bill, then I hope that the Senate will go along with those.